Hello everybody, this is JD again. I'm going to do another one that I've done already, but I'm going to do it over again because we got a lot of new people. I'm going to talk a little bit about medical. We could do medical the way that the Democrats have been wanting to do it for the last, I don't know, how long has it been since Clinton was in the White House and Hillary Clinton started a medical program that couldn't be done, which would add billions and billions of dollars to our current budget. Or we can do medical another way and not add billions and billions of dollars to our budget. See, our government likes to add bureaucracy to itself. So the first thing it thinks of is, oh, we're going to do a program. Okay, what do we got to add? What do we got to put in it to see that we could do the program? Well, let's add a couple $1 billion so we can hire some of our good old buddies. No, we're not going to do that. Matter of fact, we're going to take a program that's already in existence and amplify on it and make it better. And we're not going to add anything to the government. Whoa, no, we're not. The government doesn't deserve to be in the medical program. I mean, if you really look at how well it performs with Social Security, Medicaid, and all the other programs, Medicare, you'll see that, no, it's inefficient. It can't do its job. So we're going to take it completely out. Other than some small monitoring that will be done by our Internal Revenue Service, maybe. Make sure that proper things are spent the way it's supposed to be. Our medical is going to be completely separate and completely independent of our government. Then who's going to be doing it? Well, we're going to take an existing program that already exists and add upon it or make it greater, better. The program is, a lot of you out there don't realize you right now do have medical. If you don't have medical insurance or anything to cover, you can actually go to an emergency room and you can be treated. But that adds extra to the emergency room. But what if every single hospital in the United States had an open clinic that was completely open to the public? Then we'd have medical. What is some of the advantages of having an open clinic at every single hospital that runs in conjunction with the hospital? Let's say, for example, the open clinic would be open from 6 in the morning till 8 at night. Just as an example, that does not mean that's the time frame. Then anytime anybody wants to go and get any medical treatment whatsoever, they can go to the hospital and they can get their treatment. What are some pluses for that? One, all interns that graduate medical school would start off working in the clinic. What does that give them? Well, up until they start working with patients, they really are nothing but textbook doctors. In the clinic, they get to start to see people with real pain. They get to see people who come in who hurt. They get to see people who need treatment. This is where they're going to develop their doctor-patient relationship. All interns should start in the open clinic. After about a year and a half, then they can go into the hospital of their areas of specialty. Unless they're going to be a general practitioner, then they stay in the open clinic. Young nurses that graduate out of nursing school should be in the clinic. Now, the way it should be set up is it's not totally free. There should be a service charge or a user fee, $5, $10. If you have insurance, you lay down your insurance card or your Medicaid card or your Medicare card or your, any of those cards, and boom, there's no charge whatsoever. If you have insurance, they charge it to insurance. If you got Medicaid or Medicare, they charge it to Medicaid, Medicare. If you have nothing, they just give you a $5 or $10 service charge, user's fee charge. This is so people don't come in for nothing at all. Otherwise, you'd have people coming in all day just for the doctor to blow their nose. And I mean seriously, to blow their nose. Also, other advantages of using a hospital is the children, when they need their shots for school. The cities in the area could say, at this hospital you go to get these shots, this hospital you go to get these shots. They could have the shots there ready for you to use. Also, our disease centers would have communication completely with these hospitals. So the information would be given to the disease centers right away. So if a breakout of anything in any area, they would right away get that information. Besides all that, what is the advantage of doing it at the hospital? If you bring in, let's say you have a little boy and he's injured, he was climbing a tree and he fell. I like to use that one all the time. You bring him into the hospital. They look at the arm and say, oh, this little kid needs an x-ray. They write a little piece of paper. Just like if you had your family doctor and you went to a family doctor. He would say, oh, you need an x-ray. Sign your piece of paper. There's a little difference now. Here, you're at the hospital already. You go right into radiology. Whereas if you had your private doctor in the private practice, you have to get driven now to radiology. So there, you're right there already. You go right into radiology. They x-ray it. Oh, it's broken, all right. Write another piece of paper. Take you in. They set it, put it in a cast, and out the door you go. Unless it's a very small town, all cities and most areas have more than one hospital. So you have a choice of where you want to go. You can pick the hospital where you want to go. You will have the ability, and they will have your records there. If an emergency should happen, they bring you there. Wow, bam, there's everything. They know your blood type. They know anything about you. They have the whole history of you right there at that clinic. How would this also help the people in this country? Everybody would have access to medical treatment. That means you, the one who's paying taxes, the illegal alien, even the tourist who comes into the country. So everybody in this country would have medical. And it can be, and it could be, and it should be. Not the way that the Democrats want to do it, spend a couple hundred years studying research to raise money to, no, set it up now. How are you going to pay for it? Stop sending money overseas, for a starter. Number two, start drilling. All in our national reserves and also up and down the coast. And these oil companies, when they drill, they will have leases that they have to sign. They will give a drill pump start date. If they don't start drilling within a percentage of those days, they lose their lease, forfeit all their money. If they don't start pumping, they start paying for the oil per barrel that is estimated. And then when they are actually pumping, they will pay oil per barrel, just like a private citizen. And that money will go into our government for 60% Social Security, to make sure Social Security is sound and remains sound. 20% medical, to make sure everybody in this country has medical, like I explained. 10% for Medicare and Medicaid, and basically welfare, and 10% for Congress to waste, because they waste money a lot and they're going to cry if they don't get something. So this is JD on medical. There is a way we can do it, and we should do it, and could do it, but not the way the Democrats want to do it. We just need to add open clinics to our existing hospitals now. Thank you. Have a nice day. This is JD.